chapter on children and adolescence, picked by Dr. Fitz. I didn't have a choice, but that's okay. So, you can go ahead and start. All right. So, counseling children and adolescents in a community setting and agency setting. Now, I'm going to focus mostly on children, but I do have some information about adolescents. Okay. Mental health issues that affect children and adolescents. So, I'm going to give you a little bit of an overview of where I'm going. So, developmental considerations, bioecological considerations, that is a really hard word, counseling considerations, assessment and evaluation, and then I want to preface some of this with assessment and evaluation and designing and implementing treatment, like treatment planning, stuff like that. I'm not going to beat a dead horse because we just did a lot of that. So yeah, I'm going to do something kind of different when we get to that section. Concerns affecting children and adolescents. That too, we kind of talked a lot about diagnoses and what kind of stuff that children suffer with or struggle from in a couple of our other classes. So I'm just going to kind of briefly go over that, but I'm not going to spend a lot of time there either. Okay, approximately 20% of children and adolescents are estimated to have mental disorders of some type, and 5 to 9% of youth have serious emotional disturbances. More recently, an estimated 80% of young people who need treatment do not receive the mental health services that they need. That's pretty scary, because they become big people who haven't had mental health services. Okay, developmental considerations. Childhood and adolescence are characterized by dramatic developmental changes, physically, cognitively, socially, and emotionally. Now, we need to remember that the range of normal is wide. Kids do a lot of weird things. So, there are children who develop mental disorders that fall out of the normal range, and that these are important considerations for youth. With serious emotional disturbances, a system approach in which multiple service sectors work collaboratively, i.e. like systems of care, so for example, systems of care can be effective. So this is what I tell myself often when I'm treating a client. I am just a spoke in the cog of care for each child that I serve. So what I want to do is make sure that I'm reaching out to multifaceted agencies, the schools, their primary care physician, if they have a psychiatrist, school counselors, parent coaching. I mean, you've really got to be out there and working with a lot of folks if you're really going to serve your kiddo well. Okay, so early childhood, we're going to talk about development. This is ages 2 through 6. Motor skills are refined. They begin to build ties with peers. Thought and language skills expand rapidly. Anybody who's had a toddler will know that all of a sudden, bam, they're talking and they don't shut up until they're like 16 and they become sullen and don't want to talk to you anymore. Pre-operational, which is the ability to represent objects and events through imagination, symbolic play, drawing, and spoken language. Initiative versus guilt, the Erikson stage, is an important consideration at this time. They are able to represent and recall their feelings. Furthermore, as they near the end of this stage, their emotional self-regulation improves. That is kind of a red flag when they're at the end of this stage and they cannot regulate. Then you know that there's probably some stuff going on. The guidance of understanding adults can help them develop self-confidence, self-direction, and emotional self-regulation. A lot of that is our job as therapists. Play is an extremely important activity for children in this group. Through play, they find out about themselves and their world. Play provides a way for children to express feelings, describe experiences, and disclose wishes. Play, rather than words, help them express their emotions. I find it really cool about kids in this age group. Talk therapy doesn't work, and questions don't work at all. They'll be playing, doing their thing, and they're showing you with their play what they're trying to tell you, what they're trying to express, and you'll ask them a question, and they just won't even answer you. They'll just keep on doing their thing. It's pretty cool. So, yeah, talk therapy doesn't work. Play therapy does. Middle childhood. Ages 7 through 11. Literacy skills and logical thinking begin to develop. Cognitively, they are in concrete operational stage. I can never say that. Which means that they are capable of reasoning logically about concrete, tangible information. This is really funny. I have to tell a story. So I had this kiddo in, this is kind of a good example. So I have this kiddo in Sunday school who's 7. And we're talking about Jesus. It's kind of off topic, but kind of is a good example of concrete and how they think at this age. We're talking about Jesus and how he comes and can live in your heart and all that stuff, and he can be inside of you. And he says, do you ever think Jesus gets grossed out? Why? Because he can see inside you. All your blood and guts and stuff. And I was like, oh my goodness. I was like, you know what, buddy? I'm sure he can handle it because he made you. Oh yeah, I guess you're right. Isn't that funny? I mean, this is so how kids think in this age. Industry versus inferiority. So the Erikson stage of that is very, very important to consider this time. Interpersonal skills are required, including learning to get along with age mates, groups, and institutions. The guidance of understanding adults can help with developing interpersonal skills by implementing preventative strategies targeting social skills development and resiliency skills. Adolescence. Youth mature physically. They develop an increased understanding of roles and relationships. So in this stage, that is what's going on with them. They acquire and refine skills needed for performing successfully as adults. That's something to definitely keep in mind in adolescent stage. They begin to shift from concrete to formal operational thinking. Identity versus role confusion is very important to consider in this stage. The guidance of understanding adults can help young people deal with issues of complex relationships and decision-making about the future. That's why in high school, quite often, career counseling begins to take shape for them. Okay, bioecological considerations. Whew, I said it. The characteristics of a person at a given time in his or her life are a joint function of the characteristics of the person and of the environment over the course of the person's life up until that time. That is something as counselors we need to take into consideration. So, the bioecological model, 5 interactive systems. So, we remember this. I'm sure when you were studying for your comp exam, you remember all these terms. So, I'm just going to go over briefly. Microsystem, the family, peer group, school group, church, those are microsystems. Mesosystems, the interactions among 2 or more systems, like school and family a lot of time interact. Peers in school interact. Church and family interact. Our government would not like school and church to interact, but that happens too. Okay, the exosystem, indirect influences on a child's development. So dad's boss yells at him, he comes home, they don't have a dog, so he yells at his kid. So that would be how dad brings homework stuff and it affects the child. Macro system, so belief systems, culture, through cultural tools and institutions. So that's what my macro system is. And then the chrono system, and so we can remember that by chrono meaning time. So the evolution of the 4 other systems over time. Okay, so psychological, biological, and genetic influences. Temperament, so traits such as attention span, goal orientation, activity level, curiosity, and emotional self-regulation. This is really something to keep in mind. Let's say you're working with a kiddo that's adopted. Their temperament might come from their biological parents, right? Or even from, you know, like certain cultures kind of have a different temperament than others, like more relaxed. Like I have to keep reminding one of my parents all the time, your child is from a more relaxed culture. She might have inherited that from her parents. She's not going to be as driven as you, and you can't hold her to that standard. So we need to make sure that we keep those things in mind when we're looking at kids. Cognitive factors like intelligence, information processing skills, and neurological conditions. Just as genetic inherent Inherited influences individual characteristics such as temperament and cognitive function. It also influences mental health. Children and adolescents who are genetically vulnerable to specific conditions may benefit from preventative efforts treating certain areas, such as building resiliencies and improving coping skills. Contextual influences. So there's family influences. Family models of relationships, family relationships are complex and influence developmental both directly and indirectly. Family plays, I think a lot of times parents don't realize how much the family has an effect on the development of their child. You know, they're just cruising through life and then they don't realize that stress, anxiety, family discord, all of that can affect child's development. School influences. Through interactions with peers, teachers, and other adults in the school system, young people make judgments about themselves, their capabilities, and their goals in the future. You all know my second grade teacher had a huge impact on me because of some of the stuff she said to me. That's pretty amazing. She probably had no idea what she was doing, but you know, I carried it with me. Peer influences. Peer interactions play a key role in helping children learn to take different perspectives and understand others' points of view. Contextual influences continue. Okay, so we're going to talk a little bit about normative and non-normative life events and how they influence kiddos. So normative events are anticipated generic challenges that most people encounter. Non-normative life events are those unexpected, acute demands that may alter the course of development. For instance, parental divorce, a sudden death in a family, illness, disability, job loss of a parent, catastrophic phenomena like the Hurricane Katrina or something like that can affect children. Cultural influences. The broader culture in which they live, of course, is going to influence them. And we have to consider that when we're counseling children, just like when we counsel adults. Building a counseling relationship. Establishing rapport. Counselors need to tailor their responses and their interactions to fit the specific needs of each child. You really have to be creative when you work with kiddos, or they will get bored. And you really have to, kids want you to know them. Like, they want to bring their toys and show you. They want to bring their pets and show you. They want to tell you all about things that, you know, they want to ask you about a movie that they saw, and they want you to know about it. So you kind of have to be ready for those things and be interested, genuinely interested in the things that they're interested in, because it really, really helps establish rapport. So I'm going to give you my 2 cents out of it. I pulled that from the book, but I'm like, yes! Now I'm going to say what I'm going to say. Because, you know, children do not live in a vacuum. We need to consider all aspects of their life in order to build a trusting, significant relationship that promotes change. We need to engage the child. And when we're there with them, you need to be 100% present and be all there, because I'll tell you what, kiddos are more intuitive than adults are. So if you're not all there, they will know. They will know. Enter their world and then use a multimodal approach to treating them. Okay, so instead of talking about confidentiality like we would with adults and talking about, you know, disclosures and blah, 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 it's all in the book. I'm going to show you how I tell a kid about all that stuff. Because we've talked about disclosures and all those things in our pre-practicum class. And I have found that actually parents get it a lot better when I read this book with a parent present. It's pretty cool. So I'm going to bust it out and I'm going to read it to you. So, this is called A Child's First Book About Play Therapy. Have you ever noticed how some kids have problems? They might get into fights a lot. They might have trouble sharing. They might feel shy and nervous around other kids. Or maybe they worry a lot. Doing one of these things a lot means that kids have problems. A problem is a thing you worry about or feel bad about. Sometimes a problem makes you want to cry, or hit someone, or be all by yourself. It's hard to keep having these problems. It bothers children. They don't know where the problems come from, so they can't make them go away. Then they need help. Sometimes a mom or a dad can help, but sometimes you need special help. There are some special kinds of helpers for children with these kinds of problems. Some people call them worry doctors, but their real name is child therapist. There's only one other big word in this book, like therapist. Child therapists help children learn about the worries and the feelings that make the problems in the first place. What happens when you visit a child therapist? Will they talk to me like my teacher? Will they give me shots like my doctor? Ouch! Will I go all by myself? She looks worried. First, a therapist will meet with your parents to find out about the problems. Second, your parents will bring you to see the therapist. Third, then your parents and the therapist will plan the best way to help you. The plan. Usually children will visit the therapist once or twice a week. You will get to talk to the therapist by yourself, and you can talk about anything you want to. Every once in a while, your mom and dad will talk to the therapist, and then this is where I pause and say, I do things differently. I will talk to your parents every week for 10 minutes while you play by yourself. And then I will come get you and we will play for 45 minutes by ourselves. Children get better quicker when parents meet with a therapist too. They will help the therapist understand you better, and the therapist will teach them new ways to do, things to do when you have problems. Do you remember we said that you can talk to the therapist about anything? Well, there's something important you need to know about that. Here comes the other big word we told you about, confidentiality. Whew, that is a big word. Confidentiality is like a one-way secret. Therapists don't tell anyone the ideas or the feelings that kids work on. They keep them private. But kids can talk about them if they want to anybody. What's in a therapist's office? Toys, lots of toys, and art supplies and some other things too. Look at all of those things. When kids play, the therapist can understand their feelings and their worries. That's because children play their feelings better than they can talk about them. Child therapists help them understand their feelings while they play. Children's problems seem to get better when they understand their feelings. That's because kids sometimes have feelings they don't even know about. They don't even know they have them. Really? I think so. So how do we find out about these feelings? Well, you play, you talk, you might draw. And the therapist listens and watches, understands. Sometimes plays too. I play every time. Figures out the feelings and talks with kids about them. How do kids feel doing all of this? Well, you might feel interested or confused. Sometimes you feel sad. Sometimes you might even get mad. And you get glad, which means happy. Lots of other feelings too. Therapists and kids talk and talk. We do more playing than talking about these feelings. Sometimes it takes a long time. And sometimes children don't like to listen to the therapist, especially when they are mad or sad or confused. Then they don't like what the therapist has to say. But you know what? That's okay. Because the more kids talk about any of these feelings, their problems, they seem to get smaller and smaller and smaller. Getting better is hard, and it takes a long time. But finally, kids feel better. Yay! And then it's time to say goodbye. Saying goodbye to your therapist, who is your own special helper and friend, can be hard and scary too. This goodbye is different from other goodbyes because it's like saying a long goodbye. Kids have some pretty important feelings to talk about at the end. And also, sometimes their problems seem to come back a little, but only for a short time. This last part of therapy usually takes 1, 2, 3, 4, 5, 6, 7, maybe 8 weeks. Here are some questions kids have at the end of therapy. And a lot of times what I like to do is I read this book at the beginning, and then when we're getting ready to terminate, I read the last half of it again to kind of talk with the kid about what to expect in the next 7 to 8 weeks. Is my therapist going away? No, your therapist will still be in the office. It's just that you won't have to see them anymore. Will I ever see my therapist again? If you need to, your parents can call and arrange for you to visit. Sometimes I tell the parents, like when they reach another developmental stage, a lot of times they have to come back and do some more work. That happens a lot with kiddos. Will my therapist remember me? Yes, I will remember you forever. I found that parents get it after this book better than after we've done the disclosure. You know, you're doing your whole disclosure and you can totally tell the adults like tuning out. They get it with this book. So it's pretty cool. Okay, assessment evaluation. I'm just going to touch on this briefly. We all know the mental measurement yearbook. You can go there and find out about all that stuff. So interviews. I feel like this is really super important. So social histories, when you're working with kiddos and adolescents, you really want to get a good social history from them, okay, from their parents. Informal. So of course you're going to assess them informally, you know, talking to them, hanging out with them, all that good stuff. I like to do an activity where you have colors for different kinds of questions and use like M&Ms or Skittles or whatever, and if they get a certain color, then they answer a question about, you know, themselves. That's a really good way to do kind of an informal assessment and get to know them at the same time. And then formal assessments. I have found, I don't know if you guys have found this, but I have found that a lot of formal assessments require you to have training to do them, which costs money. However, if you want to make yourself marketable, I suggest taking some of that training and getting some good formal training on some assessments so that, you know, you have that to kind of back up, you know, what you are doing. However, you do not have to have formal assessment training to do the parent or teacher checklists, which if you're going to work with, and they're through Checkmate Plus. So if you're going to work with kiddos, you need to have those at least. Good social history and a parent and teacher checklist. Okay. So like I said, I'm not going to talk about treatment planning because we've talked about that in great detail. You guys have seen how I treatment plan for kiddos. So play is a child's work, and this is not a trivial pursuit, and I love the fact that Alfred Adler said that. Okay, so creative interventions. I'm just going to give you kind of a short list of, and it's not exhaustive by no means. So bibliotherapy, like a book, a lot of times I like to connect a book with some sort of activity and some play and an art activity. You guys have seen that before, how to do that. Theraplay, which I did a presentation on that, attachment therapy. Philia therapy, which is family play therapy. A lot of times, like I said before, kids are not, they don't live in a vacuum, they live in a family. So a lot of times in conjunction with parental coaching, once a month or a couple times a quarter, I like to do a family activity to talk about some things that they can do as a family to help regulate or whatever. The family system tends to, that's where their need falls. So some philia therapy. Art therapy, so wow, there is so much art therapy out there. There's expressive art therapy, media, music, dance, dramatizations, painting, art, drawings. I've really connected with kiddos a lot through drawing. Family drawings, all that good stuff. You can really assess some stuff and see some stuff that you might not see in their play, or they definitely wouldn't tell you, but they would draw it for you. I've done a lot of work with bad dreams with art therapy, where you have them draw a picture of the nightmares that they're having, and then you do something with the picture, like burn it, put it on a bot bag, and they can punch the crap out of it and stuff like that. There's just something about art therapy that puts them in this space where they tend to work through some emotional stuff. They get in touch with their emotions through art therapy. Photography, I have one young lady that she's really gotten into doing some photography and talking about what this picture makes her feel, and it's pretty cool. Sand-tray, so there's directed, child-centered, Jungian, and experiential. There's lots of sand-tray techniques. Child-centered play therapy, and then there's experiential. So child-centered, it's all about the child makes the directions, and then there's also experiential, where you get involved with the play. I don't necessarily do child-centered as much as I do experiential. I feel like the child kind of needs you there with them to experience that. Mindfulness therapy, I really found a lot that it helps probably the parents more than it does the children, but it's a pretty cool thing to teach the kid how to be mindful, how to be present, how to enjoy the moment, how to regulate, how to use breathing, all those cool things that come with mindfulness. And then, of course, cognitive behavioral play therapy. We do a lot of that. I'm surprised we do. Concerns affecting children and adolescents. Like I said before, I'm just going to touch on this list. This is by no means exhaustive either. So, anxiety, attachment, ADD, ADHD, depression, developmental disorders, divorce, grief and loss, PTSD and trauma, but that's just a short list. So my advice is just play. Play therapy works. I see it all the time. It's pretty amazing. The end. Yes?
Were the authors of that book? I couldn't read it from the screen. So.
Oh, yeah. Here. You want to look at it?
Yeah.
It is actually by the American Psychological Association.
I know.
I know, isn't it? It's like such a cool way to explain it's like really cool because it explains therapy, what to expect, confidentiality, and then how to terminate, like what to expect when you're going to terminate. And that happens a lot. People are like, well, you're saying that my kid's better, but my kid has been awful the past 2 weeks. Well, remember how we talked about that? How sometimes problems come back a little because they're scared about terminating. But it'll be okay. It's going to be okay. Your kid is doing awesome. So I love that book. And it's a great way. We read that book. I kind of read it like probably at the beginning of and sometimes it takes 10 weeks to terminate or 15 weeks to terminate. But when the kid moves from dependency to growth, you kind of know, all right, we need to start talking about termination, what that's going to look like. A lot of times what I do is go to every other week or something like that and see how they do. So, anything else? Anybody else? Oh, here we go.
I do have a question that's confidentiality.
Confidentiality.
My daughter finally called you.
Yes.
She's bringing Casey, my grandson, to